Johnson & Johnson has revealed that 2 doses of its vaccine provides 94% protection against COVID-19. It further says the second dose should be taken 2 months after the first. South Africa is using the J&J and Pfizer vaccines. So let's get more on this from Dr. Angelique Coetzee from the South African Medical Association. Doc, always a pleasure talking to you. Thanks for your time this morning. I mean, I suppose for those who took the J&J vaccine could be a bit annoyed, for lack of a better word, because they thought, oh, just one jab and then I'm okay. But it seems global studies proving that they might need to go back for a second dose. Why is this so?
I'm so glad that the study has been published. And this is the biggest or the largest real-world evidence study for a COVID-19 vaccine that was done in the United States. So from our side, from SAMA's side, we had in the past few months quite a few requests from our doctors coming in and say, listen, we can see that some of our colleagues are getting infected, and we think it's time for a booster or the second dose of J&J. The problem is we did bring it to the ministerial advisory committees on vaccines, but because of the lack of data showing that indeed we need to get a second booster or a second dose of Johnson & Johnson, it was discussed and say, for now, let's put it on the back burner and wait for the data. So the data is out now, as I've said. The doctors are not unhappy about this because as I've said, we already noticed that this is happening. And we from SAMA's side would also urge National Department of Health to make sure that there's enough monies available for especially the healthcare workers to get them vaccinated with the second dose before December, because that's when we are expecting our fourth wave to come in. And remember, a lot of these doctors has been vaccinated in February this year, and other healthcare workers. So if we look at the data, then it's about a 75% overall efficacy against severe COVID-19 across all ages, and then 74% against severe and critical COVID-19, and 89% against hospitalization, and then 83% against COVID-19 related deaths. Now, although this sounds quite high, you have to understand that if you get 10 doctors dying from COVID-19 after they had the vaccines earlier this year, it's 10 doctors that we cannot afford to lose. And therefore, this for us, for the doctors, is good news. And we will urge National Department of Health to act now on this. I don't think it will be compulsory. It will be up to the doctors to decide whether they want a second dose or booster, whatever you want to call it. And I know there's also doctors asking, to get being vaccinated with Pfizer. For now, between Pfizer and Johnson & Johnson, they're not very keen to have, if you have a Johnson & Johnson, Pfizer is not keen then to give a second booster dose with Pfizer. They say, who's going to be responsible if there's any side effects? So for now, that's a bit of a political type of thing. But moving forward, hopefully there will be coming data out as well that for those doctors who doesn't want a second Johnson & Johnson but wants a Pfizer, that would be allowed in future. So let's hope.
All right. So for this second dose then, is there enough supply in the country for doctors and I suppose even other South Africans who want to take the second booster shot or a vaccine, or however way you want to term it? Is there enough to go around in this country as it stands?
So we have paid and we have ordered enough, but there is not enough. So, there's not enough stock currently. Not sure where the problem is lying with Johnson & Johnson. We did, you will see a lot of people out there going to the vaccination sites, had the choice of Johnson & Johnson or Pfizer for the public, but that was because we need to get the Johnson & Johnson vaccines also into the arms before expiry date. For now, again, there's not enough, but we did order, and it's not here yet. So, but surely, I think for people who are at the coal face, there must be Johnson & Johnson second doses being made available. We cannot simply say, oh, there's not enough money or there's not enough stock. You've been warned. We know that this was going to happen from SAMA's side, and no one can in the scientist circle say, or even National Department of Health says they was not being warned that this is going to come, that this data was going to be released, and it will show that you need a second dosage for those who want to take a second dosage.
All right, Dr. Angelique Coetzee, we have to leave it there due to time, but thank you so much for giving us this update and speaking to us.